Hi, my name is Rachel True. My topic for this project was traumatic brain injuries. A TBI is defined as a non-degenerative, non-congenital alteration in brain function caused by an external force. Some examples of external forces would be direct force, which is maybe hitting the head on a sheet of ice, rapid changes in speed, such as being in a car accident, the head being struck by an object, such as a baseball, or blast waves from an explosion causing brain damage. A TBI is a complex injury that varies greatly from person to person, and it usually causes either temporary or permanent damage and affects a person cognitively, physically, or psychosocially. Epidemiology for TBIs features some interesting facts. 2.5 million people a year sustain a TBI in America, and the TBI occurs every 15 seconds. So it's a very common, prevalent injury that you may run into as an exercise professional. The leading causes of TBI, as you can see on the pie chart, are falls, followed by unknown or other, being struck by or against an object, being in a motor vehicle, traffic accident, or being assaulted. Different types of TBIs include diffuse axonal injuries, which is when the axons in the brain are broken apart by the external damage and therefore the brain suffers. Concussions, contusions include brain bleeding. Coop-contra-coop injuries is when the brain hits the front of the skull and that part of the brain is damaged and then it bounces back from that force and then the opposite side of the brain is also damaged. Second impact syndrome is when a person already has a concussion and then they get another concussion and the brain swells up traumatically. Open and closed head injuries differ, since open head injuries are when an object penetrates the skull and damages the brain, such as a bullet, and closed head injuries can be caused by any kind of external force that does not break the skull. Shaken baby syndrome is when an infant or toddler experiences abuse usually, and their head is shaken and their brain is damaged from it hitting against the skull. Locked-in syndrome is one of the scariest ones I researched, and that's when the person's muscles are paralyzed. Every single muscle in the body is paralyzed except their eyes. They cannot speak and they cannot move, but they are aware, they are conscious, and they can only look around and blink to respond. Anoxic and hypoxic brain injuries are when there is blood flow being delivered to the brain, however, that blood does not have enough oxygen for the brain, and therefore damage occurs. So the TBIs, really, like what part of the brain is damaged will tell you about what the person will have to face when they're going through recovery. For example, if there's damage to the parietal lobe, their sense of touch, spatial and visual perception might be affected, the occipital lobe, vision will probably be affected, the cerebellum, balance, skill motor activity, coordination, and visual perception will be affected, brainstem, heart rate, breathing, consciousness, attention, and sleep. The frontal lobe, if there's damage to the frontal lobe, personality may change, judgment will be affected, problem solving, organization, and concentration might be affected as well. And in the temporal lobe, memory, sequencing, hearing, organization, and language might be affected. Whenever emergency personnel realize that someone has probably suffered from a TBI, they immediately assess the situation. So they use the Glasgow Coma Scale to give the person either a diagnosis of a mild, moderate, or severe TBI. And how they do that is using this table right here. They assess the person's ability to open their eyes, respond verbally, and respond with motor skills, and they add up all the numbers and give them the score. Mild TBIs are usually called concussions, and there's also moderate and severe TBIs. Here's my case study for the project. I chose to do a male who is 22 years old. His name is Jim, and he was in a motorcycle accident. He was rear-ended by a decelerating car at a stoplight. He sustained a moderate TBI on the Glasgow Coma Scale. He was scored an 11 at the scene. He sustained a coop-contra-coop injury specifically. He was inpatient for 3 weeks at an inpatient rehab, and he sustained muscular atrophy. His MRI determined that there was a localized damage to the cerebellum, so his balance and coordination were affected. Some of his outpatient goals include muscular strength and endurance, balance and coordination, decrease his level of depression, flexibility and range of motion, and to most importantly, regain independence with his activities of daily living. I risk stratified Jim, and he is low risk because he does not exhibit any signs or symptoms of an underlying metabolic or cardiovascular disease and has no risk factors at the time being. He's a young male who has no history of smoking. His fasting glucose, total cholesterol, and BMI are all healthy. His father is a healthy, active 60-year-old with no history of a cardiovascular event. He was previously active before the TBI. He liked to ski and play club soccer at his college, and the only medication he's been on most of his life is Prozac, which is an antidepressant. Some special considerations before we begin the exercise program with Jim. Some people may believe that the earlier the introduction of exercise, the greater the efficacy, and that is not true, absolutely not true with TBIs. The brain needs a good period of time to recuperate and recover, so pressing exercise on someone's brain who is not ready will actually cause further damage to the brain. So there's much caution needed to understand the specifics of each individual's TBI. So for Jim, he's going to need to be cleared by a physician or physiotherapist before he begins outpatient rehab. His physiotherapist may be needed at the beginning of the exercise program to determine if it's safe and just to make sure everything goes right. And exercise levels must be determined before the start of any program, so the physiotherapist or physician may look at his injury level, his health status, his pre-TBI exercise profile, and his age. To start the exercise prescription, we will examine the cardiovascular component of Jim's recovery. So I chose to make Jim do cardiovascular exercise at 40 to 70% of his VO2 max 3 to 5 times a week for 20 to 60 minutes, and different modes of cardiovascular exercise that he could do included circuit training, swimming, gentle jogging, and Nordic walking. Nordic walking is hiking or walking with the poles that you see in the bottom right corner, and circuit training is actually proven to be one of the most effective modes of exercise for post-TBI patients because it includes resistance training, lots of different motor skills to help the brain recover, and it gets the heart rate up. So most importantly, I chose activities that do not put Jim into a compromising position. The last thing we want for Jim is for him to hit his head again. For the strengthening component, Jim is going to do 2 to 3 times a week, 40 to 60% of his 1RM max, 3 sets of 8 to 12 repetitions per muscle group, 6 to 8 exercises per large muscle group, so 6 to 8 upper body, 6 to 8 lower body. Some different types of strengthening exercises that he could do would be weight machines, isometric exercises, seated or stable strengthening exercises, adaptive yoga maybe, medicine balls, using light dumbbells. We want to pair a lot of these exercises with coordination activities to help the cerebellum recover, cycling with resistance, or bodyweight exercises. The relative contraindication does not include Jim, but you might want to be aware of this when you run into a TBI patient. If they have cardiovascular exercises, you want to watch their blood pressure and maybe have them avoid static exercises because it can put their brain at risk if their blood pressure goes up too high. For balance and neuromuscular exercise, I want to focus on Jim recovering his cerebellum, so doing a lot of coordination and balance activities will really help him get back to a normal daily life. He experienced lots of muscular atrophy when he was in bed for 3 weeks, so we definitely want to build up that muscular endurance while he's doing these balance activities. The frequency should be 2 times a week, maybe done on the same day as strength training, so those muscles are already fatigued, and he will have to work on his balance even with fatigued muscles, which is good practice for him. 20 to 30 seconds per stretch or per balance activity, perhaps longer depending on the activity. And different types of balance activities that he would do would be using the Bosu ball, maybe bodyweight squats with supervision, stepping activities, standing balance activities, yoga, or Tai Chi. For his flexibility component, 2 times a week, preferably after a strength or aerobic exercise. When he is doing the stretching, he wants to feel like a slight discomfort or stretching sensation in that muscle. 20 to 30 seconds per stretch, and some different types of modes of activity that he could do would be adaptive yoga or static stretching. There are many benefits for a post-TBI patient to exercise, or there's lots of benefits from exercising a post-TBI patient. So exercise training that features both aerobic and resistance training, like circuit training, has been proven to be highly effective exercise for people with TBI. So it's great to incorporate upper and lower body work together with altering levels of resistance. You want to include aerobic exercise activities and maybe an upper body bike if they can't use their legs yet. So combining those two things together really helps them. Aerobic exercise has been proven to help levels of depression. After a study by Mossberg, he took TBI patients and put them in a control group and an exercise group, and after 4 months of aerobic exercise, he saw that the exercise group had an improvement in overall mood and emotion, which is very important for Jim since he already had depression before the TBI. It's important to exercise TBI patients because they have a 3 times more likely chance of dying of circulatory conditions post-injury. So this is really important for us as clinicians to recognize this and inform our clients about it because they have a higher risk of dying from a cardiovascular or a cerebrovascular disease post-TBI. Exercise also offers neuroprotective effects in TBI patients, which is awesome. It really helps the brain recover through neurogenesis in the central and peripheral nervous system. It helps with memory, learning, and higher cognitive function as well. Some more benefits include that cognitive deficits are attenuated, hippocampal and cortical cell death is inhibited, there's an increase in heart and lung capacity, increase in brain cell number and proliferation, improvement in cerebral function, and a significant reversal of learning deficits. So overall, it's very healthy for the body and the brain and is absolutely necessary for any TBI patient after the accident. It's important to incorporate multi-joint exercises to help Jim develop muscle memory and complex motor planning. This will really help his cerebellum heal. He might need constant cueing at first, but over time this should improve. And also through his resistance training, myokines will be released, and they have been shown to deactivate inflammatory pathways, which will help speed up healing and encourage neurogenesis, new neurons, or angiogenesis, new arteries and veins to grow. Some special considerations for Jim. He's on an antidepressant, and antidepressants have some side effects such as nausea, dizziness, agitation, and increased heart rate. So it's important to recognize this and not push him too hard. You especially don't want him to become dizzy and possibly fall and hit his head. A main goal of a TBI patient should be to increase their VO2 capacity. It has been proven that they experience, on average, a reduction of 25 to 35% of their VO2 capacity. So after TBI, they're in bed, they haven't been doing any exercise, they really need to work on their VO2 capacity for ADLs. So look at this graph. On the TBI side, their VO2 peak is much lower, their aerobic threshold is much lower than someone in a control group, and by working with aerobic exercise, we can improve that. They can enjoy their activities of daily living for longer times and eventually get back to a normal, healthy life. So occupational therapy for Jim would be very important, and one of his goals was to get back to soccer, so hopefully in maybe 6 months to a year, he could play casually again. Here are my sources, and this wraps it up. Thank you so much for listening to me today. Hope you have a great day.